My pleasure now to introduce Andrea Sutcliffe. Andrea is currently Chief Executive of Social Care Institute for Excellence. She joined Sky in April 2012 from the Appointments Commission, where she had been Chief Executive since 2007. Andrea has nearly 30 years' experience in health and social care, managing a range of services, including those for children and older people. Andrea was also the Executive Director at the National Institute for Health and Clinical Excellence for 7 years. She is an active member of the TLAP board, leading the information, advice and brokerage work team, and I'm delighted that she's still going to be part. Anyway, I'm an expert by experience, and Andrea's going to be, I'm hoping to be involved in her new role, which I'm looking forward to. Thank you.
So what I'm going to just briefly talk about to start us off is we thought we kind of, I'm only a week away from being the Chief Inspector for Adult Social Care. So Sam and I thought that it might be an idea to think about how personalisation can fit into regulation. But I kind of think that it's really, what have I learned from TLAP and how am I going to take that into the new job that I've got? So I'll just set the scene a little bit in terms of the Social Care Institute for Excellence, those of you who don't know us. Talk a tiny bit about TLAP, Sky and me, and what I've learned from that, and how I will take that into my new role at the Care Quality Commission, and then just give you a bit of an insight into what my first few weeks and months might bring for me as the Chief Inspector. So for those of you who don't know the Social Care Institute for Excellence, we're a body, we're a charity that supports improvement in care and support services for everybody involved in the sector, those people who are using services, working in it, managing it or paying for it. And we do that by sharing the knowledge of what works in co-production with people who use services and their carers and families, and in partnership with the wider sector. And we're absolutely delighted that part of that partnership with the wider sector is hosting Think Local, Act Personal, and working alongside the National Co-Production Advisory Group as well. So, TLAP, Sky and Me. Sounds like it could be the title of a film, really. But as I just said, Sky is a partner of the partnership, and we host the TLAP team. And I think that what that means is that we're involved in some joint work together, lots of mutual benefits between the TLAP team and the Sky team. We give them board and lodging. They do pay for it, but we give them board and lodging, and I hope that we also provide a measure of support for the team in the tough old job that they're doing. From a personal perspective, I'm a member of the board, and I have to say I love going to TLAP meetings. It's a bit sad to say that you like going to meetings, but actually they are meetings where the different perspectives that come across from all of those different board members get used to actually focus down on how we can move personalisation forward and what we can do to really make a difference. And it's great to be engaged with such a fantastic group of people who really want to do that. But it's no picnic, they make you work at TLAP. So I've also led, on behalf of the board, work together with the Towards Excellence in Adult Social Care team on use of resources, but also leading on the information, advice and brokerage work stream. And if you haven't signed up for your workshops yet, we've got one immediately after this, and it's going to be fabulous. So I really encourage you to come along and find out what we're doing there. And from a Sky perspective, we've worked across not just the areas that I've been directly involved in, but working with Bill Mumford and others around the defining quality, working on the personal budgets for older people as well, and I think Sarah Carr's in the room who was doing some of that work, and working on the personal health budgets. And if you haven't signed up for this afternoon's workshop, there's another one there that I'm going to be at, where we'll be talking about the integration of health and personal social care budgets and the challenges that we've got there. And last but not least, I'm a week away from moving to be the Chief Inspector for Adult Social Care at the Care Quality Commission. So with all of that background and insight from TLAP, what have I learned? I've boiled it down. I could go on for hours, obviously, but I'm not allowed to. What I've learned, the absolutely central importance of personalisation and person-centred care, and really, using the words of the fabulous production from the National Co-Production Advisory Group, making it real, actually living that every day and thinking about it on a regular basis. It's not just something that we kind of, should be shuffling off into the side and thinking about every now and again. It's central to what we should be doing in the care and support system. Working with National Co-Production Advisory Group, with TLAP, and with our co-production network at Sky, this has been part of my career in a variety of different ways. I helped to set up the Patient and Public Involvement Unit at NICE, for example, but it drips out of the DNA of Sky and of TLAP, working in co-production with people who are using services, their carers and their families. And it makes it such a rich experience, and it really does help us to root what we're trying to achieve in the reality of everybody's lived experience. And we'll do a little bit of this in our workshop this morning, but we've been running workshops with the information advice work stream, and the one in London and the one in York, and we've started off with the National Co-Production Advisory Group on the couch, talking about their experiences of care and the need and the importance of information. And it's, you can see people's mindsets changing as they're kind of reconfiguring themselves from thinking about this as an abstract, well, we've got to make this happen, to actually thinking, well, we've got to make this happen for people who are really using services and the experience that they've had. And the other fantastic thing about TLAP is the partnership working. It is a broad partnership. It encompasses people who are using services, their carers. It encompasses people who are providing services, commissioning services, and other national organisations who are there to support improvement. And I think that what I've learned from that is that you can make an awful lot happen if you work with other people. None of us can do this by ourselves, and we cannot work in isolation, and the partnership working from TLAP will come with me. So, how am I going to apply that learning? Because, that's what Sky's all about, sharing the knowledge of what works and actually helping that to make a difference. So how is that going to make a difference to me as I move into being the Chief Inspector for Adult Social Care? So personalisation, the CQC have already set out their strategy earlier this year, and one of the things that CQC is very clear about is that the regulator needs to be on the side of people who use services, their carers and their families. And you can absolutely be guaranteed that that's the reason why I applied for the job and how I'm going to do it. That may mean that I'm going to have some difficult conversations, perhaps with a few of you in this room, but it's absolutely essential, and particularly for those people, as Clinton said earlier, who sometimes don't have folk looking out for them, that in the last analysis the regulator is there for them. Co-production. There's an awful lot of work that CQC has done over the years, and definitely over the last year, around engagement, consulting with people, working with folk and trying to listen. But I'm really, really anxious to get the language of co-production into the Care Quality Commission and make that a lived reality. And it was fabulous to have a chat with Marjorie last week about her experience as an expert by experience working with CQC, and for me to think about how we can actually roll that out and make more of that as we go forward in the future. Information and advice. All of the work that we've done through the information and advice work stream makes it absolutely clear that that is central to personalisation working. people need to be able to have informed choice and control. You know, it is no good if folk are actually wandering around the maze of the health and social care system and not understanding it. And it's one of the reasons why I love our jargon buster so much, because actually, you know, what it's about is saying we shouldn't, you know, we had various Twitter conversations about this, and one of them saying, well, we shouldn't have a jargon buster because we shouldn't be using it. So I think that that takes us back to Clinton's journey, which is that that's the stop along the way, and maybe eventually we'll get to the fact that we're not going to be needing a jargon buster because we're all talking plain English that everybody can understand. But actually this will help us along that journey, and I take Marjorie's advice never to give up on it as well. And then on the partnership working, you know, it's really interesting kind of taking on this new role and thinking about what is it that a regulator can do. And actually, in some ways, it's quite limited, because I'm not there when care is being provided. I'm not there when managers are trying to work out what the culture should be like in their care home or in the service that they're providing. I'm not there at board meetings when people are determining what the resources are that are going to be allocated, and I'm certainly not there in council offices or meeting rooms when people are determining how budgets are going to be set and how commissions are going to be made. You know, I'm not there. Other people are, and other people have responsibility for the quality of the service that they're delivering, that they're providing, that they're commissioning. And what I think that regulation can do is to be that backstop for those for where that's necessary, but also to be an inspiration for all of those people to actually ensure that the way that they're looking at what they're doing is to actually provide the best service and deliver services which treat people with dignity and respect and support their independence. So I can't do it by myself, and I'm definitely going to need all the help I can get. So the partnership working that runs through TLAP will have to run through the way that I approach the job at the Care Quality Commission. We've set out that the regulatory regime that the Care Quality Commission is going to be implementing will focus on 5 key questions. Is the care safe? Is it effective? Is it caring? Is it actually responsive to people's needs? And is it well led? And I buy into those 5 key questions, absolutely. We might ask them differently in social care, because what's effective in social care will be different to what's effective in an acute hospital. And we've already had that challenge from some of you in the room about, well, you know, you could answer all of these questions, but are we still enabling people to live independent lives and support them in that way? But I think that we can ask that question in the effective domain. We don't need to say that we have to be completely special and different in social care. We can apply this model, but we've got to apply it in the context in which we're providing and supporting services in social care. But there's a lot to do, I think it's fair to say. You've all seen the press, you've all seen the challenges that the Care Quality Commission has, and I've kind of worked out that initially I've got 5 priorities, and if I say them really quickly, I might get them over and done with by Christmas. Probably not. But the 5 key priorities, we have been absolutely clear at the Care Quality Commission that the current generic inspection regime has had its time, and we're going to be moving into specialist inspections which will focus on the specific areas. And so one of my first tasks is to work out how we're going to do that for adult social care. But there's a lot to build on there, because predecessor organisations, I think, point us in the right direction. We're going to use that new inspection regime to develop ratings, and that will be a way of feeding into the information and advice so that people can see what services are. And my aspiration is that when The Guardian does its kind of weekly thing about where do you go to, where you might want to live, and they tell you what the Ofsted rating is for the local school, I want them to be telling you what the CQC rating is for the local care home. There's a new role and responsibility that CQC are going to have around market oversight, particularly for the larger providers around their financial regime. There's a really important role for me in developing and supporting our people within CQC to deliver on all of these priorities, and for me to work with them to kind of say, actually, there's a lot of good that's there, and we've got to build on that, but we've got to work with others, our experts by experience as well to move on. And I crucially need to build confidence in what we're doing at CQC with people who are using services, carers and their families, and the general public, but also all of those other people who are actually engaged in that quality improvement journey, so providers, commissioners and other national stakeholders. So I take up post on the 7th of October, I finish next Friday on the 4th of October, so I'm giving myself a fabulous weekend off. I'm hoping to be able to publish early in October a signposting document which will set all of that out in much more detail. There will be ongoing engagement throughout October to January, and then some formal consultations which will be happening in spring of 2014. So there's a lot to be getting on with and a lot to do. But I think that the final thing is the truly personalised care passes the mum test. So this is my mum on my wedding day. She's looking quite happy. And I want to make sure that if I'm looking at anything or my team are looking at anything, they're thinking, is this good enough for my mum? And if it isn't, it's not good enough for anybody's mum. And we need to kind of bear that in mind as we go forward. So thank you all very much. If you liked anything of what I've just said, you can follow me on Twitter on CrouchEndTiger7, and you can find information about Sky, TLAP and CQC on all of those website addresses. Thank you.